And good morning again. Well, here is the latest on the Ebola situation. The death toll from the disease in West Africa stands at nearly 3,500. The threat of it spreading here has raised fears and calls for more government action. But what to do? We begin this morning in Dallas, where Thomas Duncan is now in critical condition with Ebola. He is the man who was first sent home from the hospital, even though he told emergency workers he had recently traveled from Liberia. Manuel Bojorquez is in Dallas this morning. Manuel?
Well, Bob, he has been in an isolation unit here at Texas Health Presbyterian Hospital for almost a week. Doctors say he has slipped from serious to critical condition. Health officials here have been trying to reassure the public they can stop this virus from spreading after a series of missteps. As you mentioned, he was released initially by the hospital. After a first visit to the ER, he complained of a fever and abdominal pains, but was not tested for Ebola. That may have put other people at risk. 4 family members he shared an apartment with have now been taken to an undisclosed location, but there was criticism they were not immediately quarantined. The apartment has now been decontaminated, but officials also were criticized for waiting 3 days to make that happen. Now health workers have fanned out across the city. They are monitoring 50 people who may have had contact with Duncan. They say only 9 of those are believed to have had close contact, and so far none has shown symptoms. Bob?
Is there any more explanation, Manuel, as to how they let this slip through after he told them he had come from West Africa?
At first, the hospital said there was a flaw in the way electronic records interacted between a nurse who knew Duncan had been in West Africa and the doctor who treated him. Now they're saying there was no flaw, and the team did have access to that medical information about his travel history, but they've yet to fully explain why he was released.
All right. Well, thank you so much, Manuel.